I'm waiting to see if anyone is going to join, and then I'm going to talk about pelvic floor, and if anybody has questions, please comment below and I would love to answer them on this live. And if you're watching it after this video, the live ends, please comment or send me a private message and I would still love to answer those questions. So I have a few people who have joined, and hello everyone. My name is Tulsi Desai. I have realized that since I've been doing all these lives and posting about health and all that for a while, I just assume everybody knows who I am, but I thought I would do an introduction again for new followers so that way you're familiar with who I am. So my name is Tulsi Desai. I'm a physical therapist and the founder of Active Body, Active Life Physical Therapy and Wellness. And we are located in Coppell, Texas, DFW, Dallas area. And it's been almost 2 years since I started my practice. Time flies. So a lot of people who have been following me for a while know what pelvic floor is. Some of them have some clue what pelvic floor is. Some of you have worked with me as patients, or you brought your family members to me. Some of you attended my workshop and you're really good. You have good idea on what pelvic floor is, how all that is related to childbirth, pregnancy, low back pain, and all that. But I realize there are a lot of new followers who have no clue what pelvic floor is. They are probably wondering what I do and all the crazy stuff I talk about. So I thought I'll just do a very simple Facebook Live talking about what is pelvic floor. Why is it important? Why do I keep talking about pelvic floor and not the knee pain and not the neck pain? Because there are enough people talking about knee pain and not neck pain. Most people understand what is knee pain and neck pain because when it hurts, my knee hurts. I can't walk on that knee, or I can't squat down and bend down to pick up things. So I don't need to explain to you what knee pain is, but I think most people, and even a lot of doctors, don't understand what pelvic floor is. And that's where we have a gap in medical field. So I would love to educate people on what it is. So I think this is the easiest way I can make sense about what is pelvic floor. So this is a pelvis. This is lower back and it goes all the way up. And then this is the back part and sacrum and the tailbone. So here is the tailbone. It's a tiny little bone. And then this whole bone, like the whole complex, is called pelvis. And the pelvic floor muscles are inside of the pelvis. So this whole red area that you see, it's the bowl. It's a bowl-shaped muscle, and it's called pelvic floor muscle. And now there are multiple muscles, but I'm not going to go into very technical terms and details because you don't need to know it. Just know that this whole bowl is called pelvic floor or pelvic floor muscles. Okay, I think it was interrupted. There are two layers. So there is a superficial layer of pelvic floor muscle, and then there is a deeper layer. So this layer can, a lot of times it's torn during pregnancy, during childbirth, and a woman can heal really easily, or some women just go through very traumatic experience where it tears all the way down. That's the worst tear somebody can have during pregnancy. So that can start leading to a lot of health problems or pain with bowel movement or severe constipation. So this layer, as small as it is, and people just don't think it has a major function, but it can lead to extreme pain with sex, intercourse, inserting tampons. Some women cannot tolerate OBGYN examination. All of that is related to, most of the time, to this layer, because this layer has some problem going on and it's a medical problem. The muscle could be in spasm, or they are just not able to relax, and it can lead to a lot of pain. Also, the nervous system, the nerves in that area can be hypersensitive too, and that can lead to a lot of pain too. So that's where physical therapy can help. Most people think about physical therapy as something you exercise and workouts and maybe some joint cracking and massage, but that's not the only component of physical therapy. Those are just tools we use to treat different problems, but the physical therapy is much more than that, and that's where a lot of people don't understand what pelvic floor is. So basically these deeper muscles and these superficial muscles are together called pelvic floor muscles. Now these deeper layers are basically these muscles are really strong, and they support all the organs that sit inside the pelvis. So what are these organs? So the bladder, it collects the urine, and that sits in front of the pelvis. Then there is a rectum, then it collects the stools, and that sits in the back. and then there is uterus, and I'm going to talk about women because we are talking about women's health, and the uterus sits in the in between. So there is bladder, in the back there is rectum, and then there is uterus and all the ovaries and everything in the center. So that's what fills up pelvic floor, mainly the pelvic cavity, and these pelvic floor muscles are supporting all those heavy organs. Now during pregnancy, the uterus grows and the baby is inside, and the weight only keeps the weight keeps getting more and more and more by the end of the full term, by the time baby's full term. And these muscles are what's supporting all that weight during pregnancy. And during childbirth, these muscles have a role too. And when they don't function the way they should, or they get traumatized during delivery, that's when it can start leading to a lot of pelvic floor problems. So I just wanted to come on today and talk about what is pelvic floor. Why do I keep talking about it? So this is what it means. This is what pelvic floor means, the deeper and the superficial layers. Now I will come on live again some other time and talk about what all problems can it create, what kind of problems are pelvic floor problems, what happens when something goes wrong with these muscles. But I'm thankful for all the people who joined. I think there are some comments, and hi Radha, Genesis PT, thank you so much. Hi Vikas, and hi Mega, thank you for watching. And does anyone have any questions? Please type in. I would love to answer any questions you have, but I hope this clarifies what is pelvic floor, why does it matter. Those muscles are same muscles as our biceps and quadriceps and abdominal muscles. They are same quality muscles that are inside the pelvis, and we can control them. We can squeeze them, we can relax them, and we can use them according to our wish. But when there is a neuromuscular imbalance, and when there is some trauma, or when there is something that goes wrong and these muscles forget how to work the way they are supposed to work, or they're just not strong enough, or they're not flexible enough, or they're super tight. There are so many things that could go wrong with any muscle in our body, and pelvic floor muscles are one of those muscles. And when something goes wrong there, it can start affecting your peeing, pooping, and sexual life, as well as childbirth and even reproductive life. There are times it can interfere with fertility, and a lot of times treating it can help with infertility and improve the chances of somebody getting pregnant. So again, these are very complex things. I'm not going to go into all the details in this video. My goal was to just clarify what pelvic floor is. Hi Nirali. So there are people who are joining, and I just want to show you what pelvic floor is. These muscles deep inside the pelvis are called pelvic floor muscles, and that's what we treat. We also treat low back pain and other things which generally are associated with pelvic floor problems, but I'll talk about it on another video because I think that's too much information. Also, if anybody is interested in learning more, you have more questions, and you don't want to wait for me to come on live because I don't know when I'm going to go live again. I will hopefully sometime soon in next few days. But if you want to just discuss your particular problem and you want to learn what might be going on, is this a pelvic floor problem, feel free to private message me on this page or my personal page if you're my friend on my personal page, and ask me any questions. I would love to answer it for free. I'm not going to charge you. You can also visit my website www.activebodyactivelife.com, and I have some articles under publication. If you go, I have written some articles for different magazines, local and international, and those magazines articles will explain what pelvic floor physical therapy is, but it's still not going to be same as talking to me. But if you want to just learn something on your own, go to my website and learn it. There are a lot of videos as well you can watch and read those articles. And if you want to just directly talk to me and not waste your time, I would love to talk to you, guide you. If I can help you, I will tell you what your treatment options are. If you need to be referred out, I would love to find you a provider that's going to give you a good quality care and you can trust. So if you want to reach me, you can call me or text me at 214-210-0715, or you can reach out to me via private message on Facebook, or you can send me an email at info@activebodyactivelife.com. And all this information is on my website as well. So simplest thing would be go to my website, find the information, and give me a call or send me a text message. or email. And also this Facebook page has all the information too. So hopefully this will give some of you some clarity on what pelvic floor is. If you have any problems with bladder, urine leakage, urinary incontinence, difficulty emptying the bladder fully, any kind of sexual pain, or any kind of other problems, if you have any chronic constipation or leakage or anything, a lot of these functions are related to pelvic floor, and pelvic floor can improve those problems. And I have treated so many patients where we were able to fully get them back to their normal life and normal way of living without any leakage or any pain. So don't wait for things to get better on its own. They may not get better on their own, especially if you have been suffering for months or years. Take that first step and inquire what your options are. Okay, talk to you later. Bye.